Welcome everyone to this Sunday afternoon. I just wanted to hop on here real quick and talk a little bit about pain, discomfort, chronic pain, injuries, and what have you. I'm just going to tag a few people on here and allow a couple people to hop on here. But if you hop on, tell me what you're doing on this. It's kind of rainy here. We're actually in... Hold on just a second. Well, I'm in West Virginia, so I'm just going to put this in one of my groups. Okay. In West Virginia, it's really been rainy, so tell me what you're doing on this rainy afternoon. And if you're from somewhere else, tell me what you're doing. Is it nice there? Is it sunny? What you're doing there. So, but again, I just want to really discuss pain and inflammation and what do you do? So guys, I want you to think about when you're in any type of pain. Those who don't know me, I'm a massage therapist. I've been a massage therapist for 22 years. So I see all kinds of different types of patients come in and out of my office. So how do you address pain or discomfort or injuries? So I want you to think first, if it's an injury, what that injury is. How long have you had it? Have you been suffering it for a while? Have you had surgery and what have you? Now, if it's like a discomfort or a chronic pain, I want you to remember, guys, how long you've actually had that for. So how do you address something that you've had for years on a day-to-day basis? So the important thing is that you get on a routine. It's all about a routine. Those of you that have actually laid on my table, you can't get one massage and expect everything to be okay, no matter who the massage therapist is, no matter how great the massage therapist is. So it's all about consistency on a regular basis. So just like, say you wanted to lose like 5 or 10 pounds. We can't go to the gym and all of a sudden we've lost 5 or 10 pounds or even more. So it's about getting our routine and staying with that consistency. So, and same thing with eating right. Do we want to feel better? What are you putting in your body? Are you allowing your body to have what it needs to recover from those tissues? And I'm going to address that a little bit. The next few weeks, I'm actually going to be talking on things that we can do on a regular basis to help our bodies fight and recover, tissue repair, and I'm going to be addressing those a little bit as well, because we need certain type of enzymes to actually help our bodies start recovering. So let's get back a little bit on track. I really wanted to talk about layering with whatever you have going on. So again, think about, is it chronic pain? Is it severe discomfort? Is it just a tension headache? Do you suffer with regular migraines? What is that tension coming from? Do you have like gut issues? Do you have like repetitive knee injuries, ankle injuries? Think first and foremost, you need to think where that actually is coming from and how long you've been suffering for it. So we can't expect to go get one massage and take care of it. Go start rehab, and do it like once or twice and think that it's going to be all better. So it's about that consistency. So let's talk a little bit about layering. So when we'll use Deep Blue for instance. I'll just use some of my issues just to give me a little insight. And if you're watching this, why don't you, type in what maybe some of your discomforts for your body is. Have you had back surgery? Have you did something to your back? Have you done something to your cervical, your neck, mid-thoracic? Have you popped a rib out? Twisted an ankle, whatever it may be. Or are you just stressed from day-to-day life? You have so much on your plate. So type in what that is and I will help you actually address that. So let's get to the layering and using essential oils to help with that. So we'll use deep blue for instance. I really like using, one of my favorite combinations to use is deep brew, frankincense, and turmeric. And I have some other ones that I really like as well. So I just simply, was to keep it nice and simple, I simply put some deep blue in the palm of my hand, like if I have a patient coming in, or if my knee's bothering me, I wake up one morning, my knee's bothering me, I simply just take a couple drops of deep blue and rub it with some fractionated coconut oil or some lotion, and I rub it into the area. So, and remember guys, it's, these oils are very volatile. So a lot of it's going to escape. You're going to get the aromatic benefit, but how much is it going to actually get into the tissue? So one thing I like to do is trap the oil into the tissue so that it can affect the area. But again, a small percentage of that oil is actually getting into that tissue. So wait about 20 minutes or so if this is a new reoccurrence. If it is, if you've been in that pain for a long time, I'm going to address that here in a second. But say this is like a new reoccurrence and you haven't been suffering from day in and day out. So just apply that, wait 15-20 minutes and reapply that. What that's going to do is allow the oil to actually start working in on that tissue. It's just like a massage. When you go to your massage therapist, you go repeatedly so that they can start layering. It's like an onion. They're peeling away, getting to the cause, the root cause, not just what's causing you the pain right now, because they may be working one area and then before you know it, they're in somewhere else because they realize that maybe your pain's not coming from there. So it's about layering and stripping away the layers. So wait 20 minutes and reapply so that the second attempt to actually get into that tissue is going to be even deeper. So, and what I like to do is a couple applications of that. So, just wait and then reapply. Wait and then reapply. I like to wait like 15-20 minutes. And if you don't have the 15-20 minutes, those bottles are really small, so take that bottle with you, and you can get some fractionated coconut oil or some, whatever lotion you have around, and just simply, or you can do a roller ball, and I can teach you how to do a roller ball. That way you can literally, if it's the shoulder, massage it into the shoulder. If it's a knee, just get it into that tissue. So, and say you think you might need just a little bit extra boost. What I like to do is put a towel, like if it's my knee, I like to put a towel over it to trap the oils in even more, because it's a very small percentage, again, because we're talking about the aromatic benefit. So, and these oils are very volatile, so they'll escape. So trap that into the tissue so that you're going to get the most benefit possible. And say you want just a little bit extra kick. And you're using the deep blue oil. I don't like to do this with the deep blue rub because it's so powerful, and I'm all about cautious. So, or say you're using frankincense and turmeric, apply it to like the knee joint or the shoulder joint, and take like a warm water bottle and put over top, when you put a towel on, put over top of that. What that's going to do is force the oils down even deeper, and that's exactly what you want, is to get to the cause of the problem and force the oils even deeper. So now that we talked a little bit about that, I want to address, if you're one of those individuals that just suffer from pain on a day-to-day basis. Give a thumbs up or wave at me, guys, if you're one of those individuals that is suffering from pain and you have been for years. So let's address that a little bit. So whatever oil of your choice, I have some great different combinations that you can start off with. You can do deep blue, I love putting frankincense and copahiba on areas, and I love to throw in some of that turmeric, for inflammation. I like Siberian fir. There's all kinds of different combinations, and I can help you guys figure out what is the right chemical constituents for you. So say you're one of those individuals that are constantly in severe pain. I'm looking for any type of small relief. If you're suffering day in and day out, I don't want you to overlook if you slap some, if you massage some deep blue in there and you're not getting the benefit, the wow, okay, that didn't take me out of pain. I applied it in the morning, I applied it in the evening, and I still have the pain. So guys, remember, you've been in pain day in and day out for a long time. So I'm looking for, I want you to keep your eyes open. You know your body better than anyone. So I'm looking for minor benefit. So say I run into someone or one of my friends is suffering from something, or I have a patient come in and they're really suffering. So say it's like, we'll just throw out some little elements. Say it's the lower back. So, you know, maybe that tissue is too tender for them to apply the deep blue. As a massage therapist, I actually apply very light pressure, because if you slowly approach that tissue, you're going to be able to address it. So maybe if you're applying it, maybe just lighten up that pressure, or even think a little bit outside the box and maybe apply that oil somewhere else. So lower back pain, maybe massage it into the glute area, maybe massage it into the abdominal area, down the thighs. You know, we compensate on a day-to-day basis. Say if it's the shoulder, maybe take it over into the rib cage, you know, the shoulder, up the back of the neck. And again, even fascia wraps all through the body, and you can put the oil somewhere else to affect that area. So if your pressure is too much, then apply it somewhere else. And say I apply that oil and I'm just throwing out numbers, guys. Say I get 20 seconds relief, just 20 seconds. That's 20 seconds that you are out of pain. Now, the people that I deal with, they would be ecstatic with that. You know, that's 20 seconds that I don't have that constant pain. So at that time, I'm going to apply more of the oil. So, and my idea is to layer so that, you know, the first time I apply it, you'll get 20 seconds. Maybe the second time I apply it, I might get 5 minutes. And then I'm going to reapply it that 5 minutes, and maybe next time I'm going to get 10 minutes. So the idea, you are in constant pain. So the idea is to strip away the layers and slowly work on getting you out of pain. But it's a routine. It's, you know, our body wants to be well. So we have to give it the things that it needs so that it can start repairing. So again, the idea is to just keep on reapplying if you're in that chronic pain. And if you have and I'm going to be going over even more and more details about how you apply, what you apply. And I like to, as being an ex-athlete, I like to apply both the inside and the out. So I take care of the inside of my body as well as the out. So you're just going to get better results. So one thing I do like doing is I take our Deep Blue supplements, which is going to help with inflammation and repairing everything inside the body. And I'll go in more detail on that. And I also take our Copahiba, which will help with pain and inflammation. And I'll be going in more detail about that. But that's what I do for the inside. And I do other stuff for the inside of my body, diet, and we'll discuss that later as well. And then I'm going to use the oils for the outside, and work on the different layers. Again, baby steps. If it's 20 seconds, that's 20 seconds that you are out of pain. And look for signs of being out of pain, because a lot of people don't realize that they're out of pain. Over the years, I've had patients think that they're still in the amount of pain, and then I start asking them, like, what all they're doing around the house. You know, I find out before I get started, you know, before we start therapy, you know, what all they're able to do. And then by treatment, I find out even more. And a lot of times you don't even realize that you're actually doing more. So you're out of some of that pain, and then you're actually able to do more in your life throughout the day. So again, that's a little bit about layering, and think outside the box again. If you can't apply the oil to a certain area, apply it somewhere else. So if I have any questions, please leave me comments below. And there's also different oils combinations that I like putting in a capsule and taking that internal as well to really help with the discomfort and pain levels. You know, say you have tension in your head, you know, the back of the neck, down into in the front of the neck, the back of the neck. Say, you know, you have like bloating and discomfort, rub it all into the belly, even the lower back as well. Knee, down the calf, up all the way through the thigh, even the lower back, because you're going to have imbalances. So if you need help thinking outside of the box, comment below and I'll help you. And I love to be your oil girl. So if you've been talking to someone, please contact them. And again, guys, it's about purity and potency. You don't want to be putting, you know, synthetics on your body. So make sure if you're using essential oils, it is top of the line essential oils, and they test their oils. We actually test our oils over 54 different ways, make sure that it's the purest. So again, I hope you're all having a wonderful Sunday afternoon, and let me know what you guys are doing and what you're into, and I will talk to you soon. I will be back next week digging a little bit more into, you know, pain and discomfort and what else we can do, you know, some steps that we can do to actually address that, and what we need to be doing on a regular basis. So hope you have a wonderful Sunday and a nice work week. And until next time, bye.